ahead and get started on today. So, I want to welcome everyone to our training on today. Today, we're going to talk about saving babies with us. Our training is entitled Save Babies with Us. It's a guide to talking to expectant parents about fetal movement monitoring. And I'd like to thank the Alabama Public Health and Samil for helping us to get into Alabama to ensure that we are sharing about our life-saving stillbirth prevention tool that we call Count the Kicks. With that, I'd like to go ahead and get started. So my name is Stephanie Moody, and I am going to be your presenter on today. I am the Health Equity Coordinator with Healthy Birthday, also known as Count the Kicks. And here at Healthy Birthday, we have a laser focus on stillbirth prevention, but we also focus on eliminating the racial disparities that exist and persist. And as many of you may know, statistics do show that Black women are twice as likely to lose their child to stillbirth and 3 to 4 times more likely to die while giving birth. So my responsibility is to look at the inequities in birth outcomes in your state and then work with the community-based organizations to develop strategies to address the inequities that exist. So part of that strategy is building those partnerships with community-based organizations that serve within communities that are considered to be marginalized, so that we're not only educating the expectant parents, but we're also educating the providers, the doulas, the midwives, home health and maternal health workers. Our goal is to work together with those who are the boots on the ground, getting the information into the hands of those who are most impacted by stillbirth outcomes, moving us to a place where race is no longer a predictor of stillbirth. So my passion for this work in stillbirth prevention came after finding out about the inequities that persist in stillbirth outcomes in the African American community. My passion for the fight against preventable stillbirth inequity comes from the impact that stillbirth actually had on our family after my sister Angie lost her daughter Jasmine to stillbirth in the early 90s. So she was told to lay on her left side, drink water, all of the things that they would tell people. But this was Angie's fifth baby, and she was trying to explain something's wrong, something's different. There was no Count the Kicks app then, so she didn't have proof. Unfortunately, Jasmine was born still because her umbilical cord was too short. And so we had to go through all of the things that you would have to deal with after having a child full term but born still. So while we were working on this campaign to educate faith-based and community-based leaders in Des Moines, my son and daughter-in-law became pregnant. And I asked Courtney if she had heard about the Count the Kicks app, and she was actually using it. And so on her due date, Courtney thought she was in labor, but she noticed Luna was not moving like she usually was. It was taking her longer to get to those 10 kicks. And originally, when she called them, because she was a first time mom, they told her to drink water, lay on her left side, time the contractions, and to come in when the contractions got to a specific place. And so, as a first time mom, we know that parents can feel a little anxious about giving birth, but Court decided to trust her instinct and to trust the data that she had in her hand, and they went into the emergency room anyway. She provided the doctor there with the information that she had from tracking Luna's movements and was able to prove that Luna was not moving like normal. They examined her and found that there were two health issues that would have prevented our Luna from having a healthy birthday. Since then, I've continued to educate and empower expectant parents and maternal health workers on the importance of counting as well as tracking their fetal movements in the third trimester. So saving babies, yes, this is my dream job, and I am so honored to be able to share this information with you on today. So one of the most powerful and effective ways that we have found to educate expectant parents is through our use of mom-to-mom sharing, through the testimonies of those whose children were saved from counting and tracking their fetal movements in the third trimester. We have seen a ripple effect helping expectant parents know about this life-saving tool that we call Count the Kicks. So the Baby Safe story that we're going to watch together was shared on Good Morning America, and it's about baby Ruby. Her mother, Eileen, saved Ruby's life through using the Count the Kicks app. Let's go ahead and take a look.
we're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble. For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
Life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby. Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
We are still hearing the testimonies from the ripple effects of baby Ruby's story to this day. It's stories like these that are reminders of why we do what we do each and every day. Now, I'm sure that each of you probably know these definitions, but I would like to go over them to ensure that everyone on the webinar is on the same page. I always like to start by sharing the differences in the definitions of miscarriage, stillbirth, and infant mortality, but more importantly, the statistics that go with them. You would be surprised at the number of maternal health workers who are unaware of the differences between stillbirth and infant mortality. Miscarriage is the loss of a baby before 20 weeks of pregnancy. Stillbirth is the loss of a baby after 20 weeks of pregnancy. And on average, we lose around 23,500 to 24,000 babies to stillbirth annually in the United States. Infant mortality is the death of an infant before his or her first birthday. Now, on average, we lose around 22,000 infants every year before their first birthday. But notice that the stillbirth rate is slightly higher, so we must recognize that it's just as prevalent as infant mortality, yet no one is talking about it. If you ask expectant parents about the Back to Sleep campaign, most can explain what it is. This is not to speak down about this campaign because they are both necessary. The point that I want to make here on today is that there are preventative measures that exist for both and should be discussed by OBs, doulas, midwives, and maternal health workers everywhere. It should be just as common to share stillbirth prevention methods with expectant parents as it is to talk about prenatal vitamins. The only way to impact these losses is by starting with awareness and moving to solution. Our Count the Kicks app is a viable solution to reduction of the stillbirth rates, and I'm going to show you how. The graph here shows how stillbirth in this country compares to infant mortality or infant death. As far as the number of babies lost, as you can see, again, stillbirth is just as prevalent as infant mortality. Yet again, no one is talking about it. It's not until we recognize that stillbirth is an issue in the United States and counting fetal movement in the 3rd trimester is part of the solution that we will see that reduction that we're looking for in the numbers. So the likely causes of and contributors of stillbirth that's been identified by the studies that are listed below And we've got it listed from most common to least common. So one of the common factors is pregnancy and labor complications. That caused almost 1 in 3 stillbirths. These complications included preterm labor, pregnancy with twins or triplets, and the separation of the placenta from the womb, also called placental abruption. The placenta provides the nutrients and oxygen to the fetus. Pregnancy and labor complications were more common causes of stillbirths before week 24. Also, problems with the placenta caused almost 1 in 4 stillbirths. One example of a placental problem that causes stillbirth is insufficient blood flow to the placenta. In an SCRN study, placental problems were the leading cause of stillbirths that took place before birth, and these deaths tended to occur after 24 weeks of pregnancy. In more than 1 of every 10 stillbirths, the fetus had a genetic or structural birth defect that probably or possibly caused the death. In more than 1 of every 10 stillbirths, the death was likely caused by either an infection in the fetus or in the placenta, or by a serious infection in the mother. Infections were a more common cause of death in stillbirths before 24 weeks than in those after. Problems with the umbilical cord were also considered a probable or possible cause of about 1 in 10 stillbirths. For example, the cord can get knotted or squeezed, cutting off oxygen to the developing fetus. This cause of stillbirth tends to occur more toward the end of pregnancy. Medical issues in the mother, like high blood pressure, whether due to chronic high blood pressure or preeclampsia, also contributed to stillbirths. These types of stillbirths were more common in the end of the 2nd trimester and the beginning of the 3rd, compared with other parts of the pregnancy. Other issues like diabetes were considered a probable or possible cause in fewer than 1 in 10 of the stillbirths that were studied. So let's take a look at the national stillbirth rates first, and then we're going to look at Alabama's stillbirth rates. Nationally, 1 in every 169 pregnancies end in stillbirth. And as I stated earlier, racial disparities persist. Black moms lose 1 in 96 pregnancies to stillbirth. This means that Black moms are twice as likely to lose their baby to stillbirth when compared to their white peer, neighbor, friend, or family member. Hispanic moms lose 1 in 199, Indigenous moms 1 in 138, white moms 1 in 204, Asian Pacific Islanders 1 in 233. And as you can see, it's just as prevalent as infant mortality, and families are 10 times more likely to lose a baby to stillbirth than they are to SIDS. So here are the stillbirth rates for Alabama. The blue line represents the United States stillbirth rates. The red line is Alabama's trending rates, and you can see it's trending way above the national rate. If we look at the 5-year average in Alabama, we're losing 8.85 babies per 1,000 live births. That means 1 out of every 113 pregnancies ends in stillbirth, which is approximately 527 babies and over 1,000 parents who are affected by stillbirth every year. This number does not include siblings, aunts, uncles, grandparents, friends, and neighbors who are all affected by the loss of this baby. This is why opportunities like this for us to educate those who serve expectant parents is so important. These are the statistics for Iowa. This data shows the life of our campaign. The red line at the top represents the national stillbirth rate, and the dots and trend line beneath it are our Iowa rate, starting in 2003, going through 2020. Where the blue dot meets the red line at the top is 2008. That is the year our campaign started. As you can see, the trend line goes down from there. One important thing to note is that while the majority of the United States has remained pretty stagnant, Iowa's rate has decreased. Of course, now there's some years that it fluctuates, but it's important to look at data yearly as well as on averages. There are many outside factors that could cause a spike in stillbirth outcomes, like a large outbreak of syphilis or even COVID-19. There are a variety of factors that could lead to an increase or a decrease in a state's stillbirth rate. But one important takeaway is in Iowa, when factors like the smoking rate and obesity rate have increased during this time frame, our stillbirth rate still saw a steady decline while the rest of the country has remained stagnant. Since the launch of our campaign and our laser focus on educating and addressing the inequities that exist and persist in stillbirth outcomes, we have seen a 32% reduction in the stillbirth rate in Iowa and a 39% reduction in the stillbirth rate for Black expectant parents in Iowa. This is fantastic. And we want to bring that same reduction to the stillbirth rates in Alabama. Our 2020 preliminary rates show 4.0 fetal deaths per 1,000 live births. This is the second lowest Iowa stillbirth rate on record after the 2018 report, and we are one of the lowest in the United States. By working together to educate expectant parents, as well as all maternal health workers, on counting and tracking fetal movement in the third trimester, we can not only impact lives, but together we can save lives. The bottom line is we are better together. So as mentioned on the prior slides, there is a large divide when it comes to those who are more likely to experience a stillbirth. I wanted to take a moment to share what research has shown to be some other contributing factors to the racial disparities in stillbirth outcomes. Here at Healthy Birthday Inc., we review a lot of research articles, and these points come from various articles that we would be happy to share with you if you are interested. And you can also go to our website at www.countthekicks.org, and you'll be able to see many articles that are listed there. The question is, why are there such large disparities for stillbirth? Research shows that there's many contributing factors to the racial health disparities in stillbirth. And research points to the following as the causes for the disparities that exist and persist in stillbirth outcomes for Black expectant parents. One is systemic racism, when policies, practices, representations, and norms work together to perpetuate racial inequality. Examples include higher infant mortality rates, less school funding, harsher punishment for crimes, and even less income. This leads to toxic stress. Research shows that years of being treated unequally and or unfairly, essentially being an African American woman in a systemically unjust society and all that comes with it, have led to real and pervasive health issues for Black women. Epigenetics. Those are the physiological variations that are caused by external or environmental factors that switch genes on and off, and it affects how the cells read the genes instead of being caused by changes in the DNA sequence. Predispositions to certain conditions that may lead to stillbirth, like gestational diabetes, preeclampsia, or high blood pressure, which are all linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions. Access to health care and socioeconomic barriers. Research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby to stillbirth when compared to a high school-educated white woman. So you might wonder, what is Count the Kicks doing to reduce disparities in stillbirth outcomes? One of the things that we have done is we have hired me. I'm the health equity coordinator on staff. And my job is to ensure that we're looking at everything that we do with that equity lens to ensure that we're able to connect to the people and to those who serve expectant parents who are more likely to be impacted by poor birth outcomes. Another thing we do is we're always looking for funding opportunities to reduce racial disparities that persist in stillbirth. One of the ways that we utilize funding is we translate the app and our brochures to meet the needs of those who do not speak English. We are also an inclusive organization with 100% of our board and staff trained on anti-oppression and structural racism. We work within the communities considered to be marginalized by improving the programming that we have based on the lived experiences that have been shared with us by people of color. As we learn more about the issues that everyone faces, we identify solutions and we work with our partners in the area on implementation of those solutions. Our app is now in 14 languages. We just added 2 more. And we also ensure that we have culturally appropriate educational material. We even have low literacy brochures that are more picture based for those where English may not be their first language or they struggle with reading. We have also created videos featuring women of color so that they are able to connect with the face that they see, as well as updated our printed educational materials and our frequently asked questions in multiple languages. So part of our equity work includes ensuring that our programs, our messaging, and even our marketing connects with those who are most affected or impacted by stillbirth. So this is a video of licensed therapist Brianne Ward, who is the CEO and founder of Forward Consulting. Let's watch as she shares about the importance expectant parents counting and tracking their baby's fetal movements in the 3rd trimester. Let's take a listen.
Did you know Black women are 2 times more likely to lose their baby in the final weeks of pregnancy than their white neighbor, colleague, or friend? It's true. For Black women, 1 out of every 96 pregnancies will end in stillbirth. As a mom and mental health counselor, these statistics are beyond troubling. They're unacceptable. At Count the Kicks, we've developed a free, evidence-based tool to help you monitor your baby's well-being in the 3rd trimester of pregnancy. The Count the Kicks app is saving lives. Here's why it matters. Studies show babies move less when they aren't doing well. Just like when adults feel sick, we want to lay in the bed or on the couch. It's the same with babies. If they are struggling, their movement changes. A decrease or rapid increase in movement is the earliest and sometimes only indication that there might be an issue with your pregnancy. The Count the Kicks app is a powerful stillbirth prevention resource, allowing moms to have a daily kick counting session to get to know what's normal for their baby. You can even share your kick counting information with your partner or friend. If you notice a change in what's normal for your baby, we encourage you to speak up to your provider. Don't wait. Hospitals are open 24/7, ready to serve you. We want you to have the joyous birth experience you deserve. Download the free Count the Kicks app today.
So next, I'd like to talk about the research and evidence behind kick counting as a best practice in stillbirth prevention. So this is the research article that started the entire campaign. A group of physicians did a clinical study and determined tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the 3rd trimester of pregnancy. Dr. Ruth Fretz, who's an assistant professor in the Department of Obstetrics and Gynecology at Harvard Medical School, and who is now a part of our medical advisory board. She said babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. These are just some of the experts who agree that tracking fetal movements provides expectant parents with that mind fetalness and knowing what their baby's pattern is and increasing the bond with their baby as well. We were named as a best practice by the Association of Maternal Child Health Programs, also known as AMCHIP, earlier this year. Earlier last year, after a thorough scientific review, the leading maternal health association in the U.S. determined that our program meaningfully engages stakeholders at all levels of practice. It ensures improving health equity is an integral component of overall program sustainability, and it has been externally validated by another entity and replicated with similar positive results in another context. We are proud AMCHIP members, and we hope that you'll order our educational materials. They are free to you. We hope that you'll download our app and share us on social media as well. Or you can also work to find other meaningful ways to help us to continue in the fight for stillbirth prevention. As part of the Hear Her campaign, which was designed to reduce maternal mortality in the U.S., the CDC listed 15 urgent warning signs for expectant parents, and the importance of paying attention to babies' movements is one of the key markers. You can check out their list of warning signs and share with every expectant parent that you know. So let's talk quickly about some of the things you may be thinking. Maybe you're thinking, yeah, this is great, but it's just going to increase the expectant parent's anxiety. Well, I'm here to tell you that is not the case. As you can see from this study that's quoted here, the quote says, one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in hospital. However, most research has not found this type of increase to be true. Usually, the fetal movement count, or FMC, is reassuring to the pregnant woman and prevents unnecessary visits. And through our own research by the Des Moines University and the Harkin Institute, we had them to survey the users of our app. And the research found that 84% of app users stated that regular tracking was associated with feelings of bonding, and that 77% of the app users reported feeling less anxious. In fact, the researchers stated that using an M Health app to empower expectant parents to monitor their baby's fetal movement and showed through preliminary research that the M Health app increased awareness of a change in fetal movement and a reduction in stillbirth. Because what we do is educate and inform, these parents become educated with the data at their fingertips to be able to show and speak to their provider when there's a difference in their baby's normal movement pattern. Some additional benefits to fetal movement monitoring include reduction of preterm birth rates. Fetal growth restrictions can also be identified earlier. And another benefit is that women who have stillbirths are at substantially higher risk for severe maternal morbidity than women who have live births, regardless of the cause of fetal death. Our app has no cost, but has major benefits for parents and for unborn children because it alerts them when there is a reduction in the fetal movement. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. There are several other key research studies that you can review. This information will be in the PowerPoint that I'm going to send you, so you'll be able to look at these links and get more information. Again, you can also go to our website at www.countthekicks.org. So now that we understand the why behind what we're doing, our next step is to identify how to implement Count the Kicks by teaching your clients or your patients how to monitor their baby's fetal movements in the third trimester through use of our free Count the Kicks app. So Count the Kicks is our evidence-based stillbirth prevention public health awareness campaign that educates expectant parents on the importance of tracking fetal movement in the third trimester. Our app is that early warning system that provides them with the data that empowers them to speak up to their provider if there is a concern or they notice a reduction in how long, or they notice an increase in how long it takes for their baby to get to 10 movements. Our stillbirth prevention campaign, known as Count the Kicks, came about when 5 Iowa moms endured the heartache of losing their daughters to stillbirth or infant death in the early 2000s. They were connected through friends and pastors, and during many conversations over coffee, the women decided to turn their grief into stillbirth prevention efforts to keep other families from facing the pain of losing a baby to stillbirth. In 2004, they worked with the Iowa legislature to create Iowa's stillbirth registry so that they could begin collecting data specifically around stillbirth, because up to that point, everything was lumped together as infant mortality when they're two different things. Infant mortality is after the baby's been born. Fetal death is while the baby is still yet in utero. A few years later, they attended a public health conference in Norway where they talked about seeing that 30% reduction in stillbirth by teaching pregnant women how to monitor their fetal movement during the third trimester of pregnancy by doing kick counting sessions on a daily basis. So we didn't create kick counting, but we created the tools. We created the app to help parents to do it. Our Count the Kicks app is our hallmark tool. After that conference, they came back inspired by the research with the desire to see that same reduction in stillbirth rates, and together they birthed Count the Kicks. Now, I'm sure that everyone who's on here would agree. Stillbirth is not a subject that anyone is excited to talk about. This is why you'll notice when you look at our materials, they are fun, they're bright, they're colorful, they're empowering. This is exactly what the founders wanted. It's mom focused. It increases bonding. That can include the entire family. Spouses, partners, siblings can all get involved in counting and tracking the movements while baby is still yet in utero. We have both mobile app and paper charts on our website for those who maybe they don't have access to a mobile device or they struggle with access to the internet. We know that 1 in 3 at-risk babies can be saved simply by teaching expectant parents to use our free Count the Kicks app in the 3rd trimester. We have proof that it's highly effective because, as I've shared in the previous slides, we have seen that same reduction in the stillbirth rates right here in Iowa through implementation of Count the Kicks. Our app is free. It's available in 14 languages. The newest is Dari and Burmese, with additional languages that are going to be coming behind it. It is available in Apple and Android products, and if you get interrupted during a kick counting session, you can actually restart your kick counting session. You can delete a kick if they accidentally track one. Now, we're all pretty busy anymore, and if you're anything like I was when I was pregnant, pregnancy brain is a real thing. You can set a daily reminder to help you to remember to count those kicks. So after a few days of counting, and you want to count every day, preferably around the same time, you'll begin to see a pattern for the baby, and you're going to know how long it takes for your baby to get to 10 movements. The parents can review their kick counting history, they can download it, they can share it with their provider so that it can be discussed during appointments, and that history can be very useful for the provider. And it's exactly what my daughter-in-law did. She shared it with the doctors, and our Luna is here to this day. It's also available on Apple smartwatches, and you can track future pregnancies on the same profile and manage it on multiple devices that are registered to the same account. So we've added a new strength tracking feature because research shows expectant parents should also be paying attention to the strength of their baby's movements while counting and tracking their kicks. With our new strength tracking feature, at the end of each kick counting session, they'll be asked to rate the strength of their baby's movements. If their baby's movements become weaker, it can be a sign that baby does need to be evaluated. This new feature teaches us how to judge the strength of baby's movements. You can rate the session from fluttery to fierce. Fluttery is going to be the light movements that's hard to see from the outside, similar to what the expectant parent might feel when they first start feeling baby move. Fierce is going to be those strong movements where you can visibly see baby moving around on the inside, and it can literally feel like a limb is going to poke out of your belly. They simply rate the strength of the kick counting session by selecting fluttery, which is indicated by 1 footprint, up to fierce, which is indicated by 5 footprints. They can include a note detailing how the session went and what they may have noticed during the session. For this note, it just says, baby felt strong like normal. Once they finalize the session, they're going to see a graph that shows them the strength average as well as the average time that it takes for their baby to get to 10 kicks. If they notice a significant increase in the average time where it's taken baby longer to get to 10 kicks, 10 movements, or a decrease in the strength of baby's movements, we want them to contact their provider right away. A reduction in fetal movement can signal anything from low amniotic fluid to a ruptured amniotic sac or even a tangled umbilical cord. If their provider's office is closed, hospitals are open 24 hours a day, 7 days a week, ready to serve them. The risk of not speaking up outweighs the risk of not going in. They can track everything, whether it's a kick, a roll, or a jab. The only thing we don't track are hiccups because hiccups are involuntary. So we also have a new video capability that informs and educates our app users on how to count and track their baby's movements, how to use the app, why counting kicks is so important, as well as a short tutorial of any new features that we may add to the app. One of the things that we've recently added and we're excited to announce is our latest update to our app. We've recently launched a new resource that can be found in the menu. Users have access to our new website that is healthybirthday.findhelp.com. stillbirth.com. This website, it allows users to enter in their zip code, and what it does is it searches for free and reduced cost services that they might need. So maybe they're looking for Section 8 housing, local doulas or midwives, or food banks in their area. The list on this website is constantly being updated, and we look to others to let us know if a service or an organization is missing on the list. So if you notice, like, I would love for you to go ahead and download it today and start taking a look around and seeing if anything is missing. If you notice that there's some key organizations that are missing that would be helpful for those that you serve in your area, definitely contact us so that we can get that organization added to the list of available resources to better support those that we serve in your community. So let's watch a short video together so that you can see how easy it actually is to use our app.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
As you can see, it's easy to use. It takes the guesswork out of remembering and trying to figure out on an average how long it takes for your baby to get to 10 movements. It also empowers expectant parents to speak up if they do notice a change. So now that you know more about the Count the Kicks app, let's take a look at ways that you can actually integrate Count the Kicks into your practice. It's so easy, and we have created everything that you need to easily have the conversation with those that are expecting that you serve. So when you want to start having the conversations and telling them to start counting at 28 weeks, unless they are high risk. If they are high risk or carrying multiples, you want them to begin counting kicks at 26 weeks. So it's that 3rd trimester. So the way that we do it is we want them to start talking about and even thinking about their baby before baby gets here. What is it that their baby needs, or what maybe their baby could be speaking to them from, the uterus. So we want to ask simple questions and help them to understand that by doing this, it helps them with bonding. So when you're talking with your parents, you want to ask them open-ended questions that's going to get them to start talking, get them to start thinking about baby's movements. What is baby doing in there? How long does it take baby to get to 10 movements? So asking questions like, how would you describe your baby's normal movement pattern? Let's talk about how to track your baby's movements and then have that conversation. Share how movements are those kicks, rolls, jabs, pushes, anything except for hiccups. Again, hiccups are involuntary. And you want them to learn what their baby's normal time is, because it may take my baby 15, 20 minutes to get to 10 kicks, but their baby takes a half hour. It doesn't matter that there's a difference in the time. However, what we want to know is what is normal for our baby, so that when or if normal changes, we're able to do something about it. A helpful tip is to have them to download it while they're waiting on a glucose test. this is the perfect time to download the app. So we know and understand that talking about stillbirth is not something that anyone wants to do, but it is so important. Expectant parents hear about all sorts of different things that can happen to their baby. And we talk about the importance of taking folic acid supplements, of not drinking alcohol. This should be a part of your conversation and a part of any routine exams that you have with expectant parents. And so a lot of times people think, I don't want to scare moms. Well, pregnancy is full of risks that we talk to moms about. Stillbirth is yet another risk that they deserve to be educated about. Some people think stillbirth just happens. There's nothing we can do. There can be warning signs if they know what to look for. And so tracking those fetal movements in the third trimester, they'll be able to see that warning sign because of the reduced fetal movement. If baby's not feeling well, baby's not going to be moving around. It's just like we are. If we are not feeling well, we're not up running marathons. And it's the same thing for baby in utero. If baby's not feeling well, if they're stuffed up and not receiving the oxygen or the blood flow like they need, the supply that they need, they're not going to move as much. And we need to find out why. Some people think her baby's always active. It's not a concern. Babies are actually active until they're not. Cords and placental accidents can be very sudden, and expectant parents needs to know what is normal so that they can notice when there is a change. Some people think, oh, she's almost at her due date. We don't need to worry about it. Actually, the risk increases as a mom approaches or exceeds the due date. We have to understand that active babies can experience distress sometimes quickly and without any other warning signs. So we want to track those movements every day. Take that guesswork out of knowing if normal and a normally active baby has slowed down. Count the Kicks gives you real-time data. That way they can show it to the healthcare provider if there is a concern. So a lot of times we get questions on what to do or say when talking to a parent or a expectant parent who has experienced a stillbirth. And so what you want to do is you want to follow the same protocol. You have to have the conversation. We can't shy away from it. We want to read their chart before they enter the room. And since women who have had a stillbirth are more likely to experience another stillbirth, we want to start them to track their baby's movements at 26 weeks versus 28 weeks, even if they're not carrying multiples. Feel free to talk about this previous stillbirth. Acknowledge their child that was born still. Ask them about the name of the baby. Ask them about the gender if you weren't their previous doctor. Stay away from medical terms like fetal demise. You want them to know that you're connecting with them, and you want them to know that you're empathetic to what they have endured, that you care. Ask if anyone has ever talked to them about the importance of tracking fetal movement before. It's interesting that a lot of expectant parents that we talk to that have had previous live births stated that they were never told about the importance of tracking fetal movement. Some of the common myths that we see. People think only those experiencing a high-risk pregnancy should pay attention to their baby's movements. That's false. All expectant parents should be educated on Count the Kicks and get to know what's normal for their baby. Another common myth is my baby should get 10 kicks in 2 hours. This is false. Every baby is different, and the recommendation to expect 10 kicks in 2 hours is outdated. Current research indicates that expectant parents should work to understand the normal amount of time each day that it takes for their baby to get to 10 movements. Another one is, I can just use a Doppler device to monitor my baby's well-being. That's false as well. A change of the baby's heartbeat is one of the last things that occurs when a baby is in distress. A change in a baby's movement may indicate potential problems before actual changes in the heart rate can be detected. Expectant parents should only use a Doppler device under the guidance of a healthcare provider. Some more common myths are, if baby isn't moving, I should drink cold water or eat something sugary to get baby moving. This is false. Research has moved away from the idea that sugary drinks and the like are a good way to get baby to move. Kick countings is best monitored without interventions like juice or candy or sugary things. If baby isn't moving like normal, expectant parents should speak up to their provider right away and have them to do some more testing. Some people think babies kick less near the end of pregnancy. Again, this is false. Babies don't run out of room at the end of pregnancy. The type of movements may change. There may be more jabs, fewer rolls, but babies should move up to and even during labor. If an expectant parent is monitoring their movements at the same time each day, it should take about the same time, the same amount of time to fill those 10 movements. And the last one is triage doesn't need any count the kicks education. That's false as well. Labor and delivery triage is the perfect place to have this information. Posters, brochures, and discharge papers all should be used when someone comes in for anything and is sent home. So remember, when talking with moms about fetal movement monitoring, you want to stress the importance of knowing their baby's normal and to speak up if there is a concern. Make sure they know what number to call if they do have a concern. Send a brochure home with them, give them an app card, and share with them that research shows that evening is usually the best time to count babies' movements. And so you want to tell mom and explain to them that their provider should be asking about their baby's movement every appointment in the third trimester. They should be hearing the doctor or the provider, doula, midwife asking, tell me about your baby's movements. How is tracking your baby's movements going? Can you show me your count the kicks graph? What questions do you have about your baby's movements? Again, our app is free and it's non-invasive, so it's an easy way to do this. Other ways that you can integrate is you can add it to your discharge paperwork. You can have all of the front desk staff trained. You can ask patients to fill out a form to ensure that they know who to call, when to start counting. You can include it in their family care or intake form. Again, during that glucose test, after they check in and they're waiting on those labs, have the nurse talk to them about downloading the app. Download it while they wait. And then you can also add it into their electronic medical records. You can add a question that pops up in the third trimester to remind you to ask them about fetal movement. So this is one of the ways that we actually developed so that you can hand this over to them. They can fill this information out while they're waiting for that glucose test. And then that dotted line, you're able to tear it off and they can take that part home with them. So again, it reminds them to download that free app. And then it also has a place for them to keep the name of their doctor, phone number, address, labor and delivery hospital, so that everyone knows, where they are going to go and what it's going to be when they get there. Again, the electronic medical records and integration, labor and delivery triage, it can be on your discharge papers. You can easily integrate it into their electronic medical records. It can be flagged when they're 26 or 28 weeks, just asking those questions. And every time they come in, the more touch points, the better. You want to ask every single time. This is a picture of baby Margot, and her mom said, I am very fortunate that my OB office shared the Count the Kicks information with me through posters on the room walls and a brochure, as it encouraged me to download and regularly use the Count the Kicks app, which is how I knew that my baby's normal movement pattern had changed. It saved baby Margot's life. A gold standard that was implemented by Mary Greeley, they simply added it to their after visit summary, instructing the patient to download Count the Kicks and track those movements in the third trimester. Another one of our partners is Celebrate One Columbus. They added it to their intake form, and you see they just put in there, have you downloaded the Count the Kicks app, yes or no? And then it explains why it's important and that it's free. So there's some additional Alabama resources, and we'll go ahead and talk about those. You have free educational materials. We have promo posters in English and Spanish, as well as how-to posters in English and Spanish. You can have access to those app cards. You just go to counttthekicks.org and you go ahead, click on order materials, fill your card up with all the things that you would like, and it's shipped to you for free. Another great resource are our Count the Kicks ambassadors. These are women across the nation that are working hard to share our Count the Kicks education and messaging throughout their state. And they are volunteers that can help with a variety of things, just like the presentation that I am doing today. They also work to grow partnerships. They help with fundraising. They attend baby fairs and even do media interviews so that you can have someone local who can assist you there in Alabama. Your Alabama ambassadors are Jasmine Hammonds. She was going to be on with us today, but unfortunately was unable to make it today. And then the other Alabama ambassador is Amy Dodds Ray, and they would be able to help you to advance in stillbirth prevention efforts right there in your area. So next steps. This will be one of the only times you'll ever hear me talk about multitasking during a presentation or a webinar. We want you to familiarize yourself with the Count the Kicks app. So download it, it's free. I'll just be honest with you, I am over 50 years old, and guess what? I have the app on my phone, and I have no plans on having any more children. But we want you to practice using it so that you're comfortable having those conversations. Order those Count the Kicks materials at www.countthekicks.org. Designate somebody in your office to oversee ordering the materials so that you don't run out, and can be sure to hand out those brochures or those app cards to those expectant parents that you serve. Take 3 to 5 minutes with your patient or your clients to educate them. Make sure that they have that kick counting conversation at every touch point in the third trimester. Make sure your entire staff knows about the campaign and the importance of tracking fetal movement in the third trimester. Again, you can use your electronic health records, your intake forms, update your discharge papers, all of those things that you use to collect information from your clients or from your patients. You want to share that Count the Kicks information with them right there. Remember, hours and minutes matter in stillbirth prevention. Educate your patients, clients, and your staff on how to expedite concerns about movement. These are just a few of our baby saves. I thought you would just love seeing these beautiful little faces. This is a quote from Yelly, and this is Eva's mom. She said, "I'm very grateful that Count the Kicks made me aware of the importance of paying close attention to my baby's movements, and also that my provider took my concerns seriously and took action. I pray that my daughter stays healthy and continues to grow to become whoever her heart desires. I highly recommend the app to all expecting moms out there. Happy and healthy deliveries to everyone." I want to open it up right now to any questions that you may have. If you have a question, if you could just go ahead and type it into the chat, I'll be able to answer your questions right here live. So I'll give you a few minutes to type some things in. All right, perfect. Oh, here we go. Perfect. Thank you so much, Crystal. I really appreciate you being here. I want to say again, thank you for joining me on today. So glad that we could spend this time together. If there's anything that I can do to assist you in your efforts, please contact me and connect with me at moody.stephanie@healthybirthday.org. Again, thank you to the Alabama Department of Public Health for allowing us to be able to present to each and every one of you. Thank you. And Demetria, yes, this training is recorded, and I will be sending it to Samil, who will send it out to everyone, I believe. I want to make sure that that's correct. If not, I'll send it to you along with the PowerPoint. You'll have a copy of the PowerPoint. So you'll be able to watch this again in case maybe you joined a little late, or you were unable to, stay present because of something at work, or maybe got called away by a phone call or something. But again, thank you. And let's save babies together. Everyone have an amazing rest of your day. And I look forward to saving lives with you. Bye-bye.